Okay, Dr. K, you're live.
Yeah, so what's happening now is that I'm undergoing what you call a follicular unit extraction. So this device called the NeoGraft device has a little punching machine that punches a 1 millimeter punch right over the follicle. And each follicular unit has about 1 to 3 to 4 hairs. Mine seem to have an average of 2 to 3, and so we're doing it one at a time. And this is done, as you can see, without actually cutting out any of the scalp strip, which was the older method to do it. And we're going to do as many as we can and extract those, process them, and replace them in the areas that we want to replace them.
And how are you feeling, Dr. K?
I feel okay, a little bit stuffed here in this little contraption, but I feel okay. I mean, there's no pain. And I feel pretty entertained with all of you here.
All right, well, you're doing good. We'll come back in a little bit and check on you.
Okay.
Okay.